come in.
Okay, I'm going to have a sanitize first. Good morning. I am Maria Ana Katrina Pagal, your student nurse, and how are you?
I'm fine.
I am going to assess your hair, skin, and nails today. I'm going to start up by asking you 3 questions. Any history of skin cancer?
No.
Do you diagnose any tanning booth?
No.
Well, that's really good. And do you use sunscreen?
No.
Well, I highly encourage you to use sunscreen for preventing your skin to a cancer when you are around in the sun. Okay, so I'm gonna go ahead and move along by looking at your skin. So I have to put your legs up and lay back for more comfortable. So I'm going to look at your skin color by overlooking at your face and your chest. And what I am looking for is to see if there is anything abnormal like pallor or paleness, cyanosis, which would be blue, and erythema, that's red, or jaundice, that would be yellow. And now I am going to inspect your skin, and I am touching your upper extremities and your lower extremities. Alright, and I noticed that your skin is warm and dry, and I know that your skin is smooth and thin. Well, that's be normal for skin which is thin. And now I am going also to check here for mobility and turgor. When I pinch your skin up, it should be moved easily, and that's normal for mobility. And it should be right back into a normal spot, and that would be normal for a turgor. Mobility is to move easy, and turgor is to very easy to back in a place. And okay, and also when I am looking at your skin, I noticed that all are mostly same color, from light brown to a darker brown. And I don't feel anything that is larger than 6 millimeters. And then in the legs, I don't see anything moles, and I can see that the skin is normal cure, and I don't see any lesions or anything that is abnormal. And then I will get down your feet to check your skin at the back. Please stand up. Alright, so I can see is everything is normal. That's good, and please sit again. And now I am going to check your hair. So I can see that your hair is slightly dry, and the hair distribution of yours is symmetrical, and I don't see any baldness. Alright, and what I am going to do now is to part your hair for checking if there is any infestation or lesions. Alright, that's pretty normal and it's good. And now I am going to check your nails. I'm going to check your nails and fingers. The nail bed must be in pink, and the shape is round, and when I'm pressing the nail bed, it should be feel firm and not spongy. And I also check if there should be 160 degrees or less. If that, I think yours is 160 degrees, and that should be normal. Okay, and the other hand. Okay, the nail bed is pink. Your shape is round. There is a firm when pressing the nail bed. And you have a 160 degrees in there. Okay. And now I am going to check your toenails. Okay, your nail bed is I can see something that is fungent here, but that's alright, it's just a small lesions. But your nail bed is pink and your nails here is round, and I can see when I'm pressing there should be a firm, and there is a 160 degrees. And also on the other toenails, I can see that the nail bed is pink, nothing is abnormal, and the shape is round, and when I'm pressing there is a firm, and there is a 160 degrees. That's completely a normal good. So Miss Eileen, before we are done for the assessment, I just want to give you a little tool that you could use when you are assessing in your skin in any risk of skin cancer. Here, we use the ABCD. A stands for asymmetrical. Asymmetrical meanings it means that the two sides do not match. That would be a concern. B for borders. If the borders are not smooth and regular, that would be a concern. And C stands for color, and the last one is D, the diameter. If the diameter is a half of an inch around to a 5 millennium of eraser of a pencil, that would be a concern. So that's how you remember when you're assessing your skin, the ABCD. Understand?
I do, thank you.
Any questions?
No.
Okay, thank you.